Hi, this is Dr. Mike Chupp, and you are listening to CMDA Matters, the weekly podcast of the Christian Medical and Dental Associations. Well, I don't know about you, but for me, the month of January has absolutely flown by. I've been in the midst of a rush of activities and meetings and preparation for CMDA's Board of Trustees meeting that we're having this weekend in Washington, D.C. And for you, well, I expect many of you have been bogged down with patients facing all sorts of cold weather viruses, including that COVID that's still hanging around, while at the same time trying to meet all your responsibilities at church and at home, at school, and many other places. Well, despite your constant busyness and the rush of deadlines that we face day in and day out, we have a responsibility as Christians in healthcare to help address a critical problem in our country and in the world, and that problem is human trafficking. Well, I don't know if you are aware, but January is National Human Trafficking Prevention Month. And our guest today is someone who has dedicated her entire career to stopping the atrocity of human trafficking and to helping free human trafficking victims from the bondage of slavery and the bondage of trauma that they face from their time in slavery. Today, I'm joined by my regular co-host, Dr. Jeff Barrows. So would you join us for our conversation with Mrs. Ashleigh Chapman to hear how you can make a difference from your spot at the table in healthcare and likely right where you live and practice. January is Human Trafficking Awareness Month, and about a year ago, Dr. Jeff Barrows, who's with us today on CMDA Matters, interviewed a very special guest, Ashleigh Chapman. Ashleigh is a human rights lawyer, a social entrepreneur, and one of USA Today's Women of the Year. She runs the Alliance for Freedom, Restoration, and Justice Project. She spent 20 years building solutions in education, business, legal, nonprofit, government, healthcare, and community sectors on behalf of the world's most vulnerable populations. She presently serves as the president of AFRJ, a global humanitarian aid organization that exists to end human trafficking. And she's also the founder and CEO of Altus, which is a business that has a number of different components, including Engage Together, a part of her organization that strengthens community engagement, and Justice U, equipping justice advocates. Prior to Altus and AFRJ, Ashleigh served as the co-founder and director of the Center for Global Justice at Regent University School of Law. She was also the director of a nonprofit serving thousands of at-risk youth. She's been a children's pastor and a court-appointed special advocate for children in foster care. She's got some impressive academic credentials. She graduated magna cum laude with her Juris Doctorate from Regent University and then received the faculty's Most Outstanding Graduate Award there. And then she was summa cum laude with her BS from Tennessee Tech University. So we are privileged, honored that you would agree 2 years in a row on Human Trafficking Awareness Month, Ashleigh, to join both Dr. Barrows and I on CMDA Matters.
Well, thank you, Mike. It is lovely to be with you both. Jeff's an old friend. We've known each other for, I think, over a decade now, Jeff. But Mike, it's so nice to meet you too. And we're so passionate, I am personally, about the mission of CMDA, and I'm just honored to be with you today.
And Ashleigh told us just before we started this interview that she took out an hour of her time today moving into a new home. So we appreciate that, one that her husband built. I was very impressed.
Yeah.
Well, we care deeply about fighting human trafficking here. Our listeners, many of them know that Dr. Barrows may be the only doctor in America who left a OBGYN practice after about 20 years, Jeff, and decided to fight human trafficking when you realized it was a real issue several years ago, and came on staff with CMDA after that. And so this is a topic very near and dear to our senior vice president's heart. Before we jump into this topic with you, Ashleigh, could you give our listeners a good, legal, yet concise definition of what is human trafficking?
Yeah, so it's the crime of exploiting individuals for forced labor, commercial sexual exploitation, and organs as well. So what we're talking about is through force, fraud, or coercion. Another way to say that, those would be the legal terms, through violence, threats, manipulation, lies. Individuals, over 50 million individuals globally now, are being forced into what you might consider in your own brain space, what looks like slavery, from our historical settings. That is still taking place in our world. But so are new things like online commercial sexual exploitation, child sex trafficking. You might have heard that, and certainly organ trafficking as well. So we're talking about treating people in the worst of ways as commodities, and it impacts every age, every demographic, every nation, and nearly every community in the United States.
Well, Ashleigh, one of the things that drew me into the whole arena of fighting human trafficking was recognizing the important role that we as healthcare professionals have in identifying and helping these victims. So, since the majority of our listeners are healthcare professionals in various specialties, clinical settings around the country, it would really be helpful if you could speak in generalities about the type of human trafficking victims that these members are likely to encounter in the various clinical settings in which they work.
So I want to say to all those in the healthcare profession who are listening in right now that if there were one profession that I would choose to train in communities on this, if I had to only choose one, it would be you. And the reason for that is because you are the only professional that victims are actually seeking care from in communities while they are being exploited. They're not often, maybe ever, raising their hand for help from law enforcement or social workers or even concerned citizens who they might be interacting with every day, but they are seeking help when they have to. And okay, are you ready for these stats? Because they will blow your mind. Here in the United States, over 88% of victims are seeking care from healthcare professionals in our local communities on average 15 to 18 times during the time they're being exploited without being properly identified as a trafficking victim. And they're carrying with them over 10 concurrent physical, mental, and sexual health conditions. If you could let that sink in, when you have over 88% of victims seeking care from your profession in your communities, in your emergency departments and healthcare clinics, any kind of walk-in clinic, your dental offices, your alternative care settings, women's health clinics, they're walking in seeking care. You are interacting with these victims, and you may just not know what you're looking at. You're treating that thing that they're being forced to come in finally to seek care from, and not seeing the bigger picture.
Well, that really relates to my next question, and that is, I think that the reason a lot of these victims are missed by healthcare professionals is not only, in part, it's a lack of training and educating and knowing what to look for, but I think the other big piece of the picture is advanced preparation, especially in the larger healthcare entities, a response protocol or whatever you want to do. So can you talk a little bit about that as it relates to identifying and successfully helping these victims?
Well, you're hitting my top 2 out of 3 right there. So the first is individually, we need to get trained. The way that I would train an ER doctor versus a pediatrician versus a school nurse would all be a bit different. Right? You need to get trained about the unique identifiers that are likely to present in your particular setting. So that's beyond awareness, right? Perhaps and hopefully, and even now, right, we're all participating and listening in and becoming generally aware of human trafficking. But specifically, how are you likely to see the indicators? If you don't know where to go for that information, if you don't have a local task force that could come in and share that with you or others in your community, we can certainly point you in the right direction. We have lots of resources for that. But you've got to get trained. Otherwise, we're generally aware that something terrible is out there, and then we're treating people who are coming into our healthcare settings and not seeing it at all. And we have to be the ones to see it as healthcare professionals, because victims often don't know they are victims of trafficking. They know they're experiencing harm, but they might not even know that word. So we have to be the one to be able to see that. Now, so training, very specific training to your setting and your professional hat. The second is protocol development. Let's say we get trained. Let's say we spend, the time that we need to enhance our knowledge, but we don't know, we haven't predetermined, if you will, in our own healthcare setting, what would we do? when we see an individual who's in harm's way? What if it's a mom with kids? What if it's someone who has that potential trafficker or perpetrator with them in the room? How are we going to separate them safely? How are we going to care for this person, get them to a safe place? What resources are available in-house and out in our community? And that would be the third thing. So first is training. Second is protocol development in advance. Otherwise, we're wasting maybe some really important moments and maybe even missing opportunities to intervene because we didn't know what we needed to do in that moment. But the third thing is equally as important, and that is partnerships. As a healthcare professional, you have got to go ahead and bridge the partnerships that you need to bridge with your local task force, anti-human trafficking task force, your local coalitions, your local service providers. If you're in a place where you're treating a lot of foreign nationals, you need to be bridging over to your immigration lawyers or those who are helping refugees and asylum seekers in your community. Go ahead and bridge that, because helping a trafficking victim is way beyond, when we're looking at the outcomes, way beyond caring for their physical, even mental or sexual health in the moment. We have to go ahead and build that bridge to resources that can carry them forward, from their visit to you and forward into care and safety, and anything else that might need to happen. And they're not going to be able to access those. We can't just give a piece of paper, to individuals and say, okay, now go call these 10 people who will help. We've got to go ahead and bridge that ourselves. So being part of the fabric of your community that's working on this already would be critical to the outcomes of success for that moment.
Ashleigh, I want to ask a follow-up question to Jeff's question, which is, I'm trying to put myself in the shoes of many of our listeners in a place where I was maybe a decade ago, in a very busy, I was in surgery practice, but I had many partners in other specialties, and we are so dependent upon our staff in our offices. And recognizing, you tailor make that training. What can you say to our listeners who are overseeing a staff, whether it's in an outpatient setting or in a department, in terms of the training that's available to come along? It's not as if I had the time to do the training myself at their level, but you have training available for staff that come alongside our members.
We do. So we have online courses. We brought together some phenomenal doctors who are working on this issue. One, I think you guys must know, Dr. Jordan Greenbaum down in Atlanta. And so brought together healthcare providers to sort of speak into different pieces of that puzzle. So how would a healthcare professional even understand this issue from their lens? Then how would they identify this? What is the health impact of trafficking in an individual's life? That's sort of another way to think about it, right? So what are they presenting to you, not just what you're seeing sort of externally? What are the partnerships you need to build? What are the protocols you need to develop? And so we take that piece by piece. It's called the Healthcare Response to Human Trafficking. It is a 5-hour course series. So it's 5 parts, and it's a total of 5 hours with accredited CEUs, right, for all your different roles and professions. But you can take it in 5-minute chunks. We designed it so that you could take it in 5-minute or 15-minute segments, and kind of break it up that way. I'm really excited to say that we are pursuing right now an opportunity with the CDC and the NIH to create what we call just-in-time tools that hopefully will be available later this summer, in recognition of the time crunch that you're talking about, Mike, right? So how do we get just-in-time information to you as a physician if you're thinking, wait a minute, maybe I'm seeing something, that might be telling me a different story of harm in this person's life, that come with assessment tools for you and assessment tools for the victim to help them understand what's going on in their life and what local resources are available. So more later, but right now we do have those trainings available. So you can go to learnwithjusticeu.com and just find the healthcare series. And it is so good and it's so well done. And to do it together as a team would be really important too, because your front end receptionist will see some different signs of this than your ER doctor in the back, then the nurse, then maybe the hospital caseworker. And we unpack each of those onion layers, if you will, in that training too.
There's been quite the impact because of COVID-19 on human trafficking. And one of our past guests formerly of the CDC, Susan Hillis, talked to us about orphans and vulnerable children worldwide at around 10 million. And the U.S. has been disproportionately hit with that because we had so many COVID cases. So talk to us about the impact on human trafficking from COVID-19.
It would be difficult to overstate the answer on this. So I will go with sort of the latest studies that have come out on this very specific topic. So according to the International Labor Organization and those they partnered with in this summer, so a couple months, just a few months ago, they came out with what we all knew, those of us who were working in this space, that COVID, the impact of the pandemic, had greatly exacerbated the situation of human trafficking around the world. In fact, according to their research, trafficking grew by 25% all across the whole world. So we went from 40 million victims to over 50 million victims. Now, that's a grossly conservative number already because it doesn't account for the United States and many other countries that aren't yet counting or capable of counting how many victims there are. In the United States, within the first 8 months of the pandemic, and it has not ceased, we saw a 400% increase in online forms of child sex trafficking. So online commercial sexual exploitation of children. So maybe I can't travel during the pandemic, right, to rape a child, but I could pay someone to live stream that happening. And this is where this started to get webbed in with family addictions. We've seen a huge rise in this country during and post-pandemic of family members who've discovered that they can exploit their children in this way and sell them at night or on the weekends or live stream things on the internet. And these children are showing up at school the next day and at their churches on Sunday. I mean, this is a steep rise in what's known as familial sex trafficking of children that tends to feed drug addictions that are happening in that family. And so we've seen all of these forms just explode, really. And I can tell you, working with law enforcement, they are overwhelmed. I mean, they are overwhelmed and under-resourced, severely under-resourced to deal with this, which is why it's going to take all of us, especially healthcare professionals, to be those additional eyes and ears when we see something, to be able to know what to do and to participate in the care of those individuals.
Sobering statistics. Well, Ashleigh, we've been talking a fair amount about the identification and immediate assistance for these victims. But after they're freed from their trafficking scenario, I'm sure that there are many needs that they still have on an ongoing basis. And I wouldn't be surprised that at least some of our listeners might be interested in how they might be able to contribute to the provision of direct health care. So can you speak into that issue a little bit?
Yeah, it's a huge need. So I think I shared earlier just a moment ago that on average, survivors in the United States, and I would think this would hold globally as well, are challenged with over 10 concurrent health conditions during and after their time of exploitation. We're talking about complex trauma. So we need physical health, right? Providers. We need folks who are in the mental health, especially space, to be wrapping around support. And we need those working in the sexual and reproductive space, wrapping around support, and not just in the moment, but long term. Well, walking alongside individuals as they're kind of healing from all of this. And that takes time. We all know that takes so much time. My greatest encouragement to those who are saying, hey, yeah, sign me up for that. What do we do? Is first to enhance your own understanding of trauma-informed best practices. This level of trauma that an individual has experienced in their life there almost are no words to express that. And if you're not trained in sort of the latest techniques on trauma-informed care, how to empower choices and give agency, and yet, and all that is arranged depending on if we're talking about a minor or an adult, if we're talking about a labor trafficking victim who's an adult male versus maybe a sex trafficking victim with children, right? So everyone's situation is different. But go ahead and increase your understanding of those trauma-informed practices. Lots of resources out there for that. Come alongside those who are already working in your community. So go ahead and build a bridge to your local shelter and your local restoration home and your local task force. They would love to hear from you. If you could say, hey, I'm a dentist and I'd be willing to be supportive of victims who need help with that. Or I'm a counselor and I'd love to be helpful. How can I be helpful? They are desperately needing you in this fight in your local community. So go ahead and raise your hand and proactively, build that bridge. And then there are going to be so many ways to fill a gap in your community. And I will say this is one real big challenge that I don't have a solution for. It's just like carte blanche, but you will need to know it's there as a healthcare professional. Access to health care is a real challenge. I don't mean like a visit. I mean, ongoing healthcare is a real challenge. Being able to pay for health insurance is a very real challenge for survivors. So finding ways to innovate around existing barriers to all of that in a survivor's life, whilst also being able to provide care, is going to be a big part of that reforming the brokenness of our systems that led to exploitation. And I think healthcare has a seat at that table too.
Well, Ashleigh, there's no question that this organization, 92 years old or so, that Jeff and I are help leading, has a deep, deep commitment to fighting human trafficking and freeing prisoners. And we have a human trafficking commission that Jeff serves on. We have a team of over 20 women in Nicaragua taking care of women who've been trafficked. Dr. Trish Burgess from our Global Health Outreach Ministry has 3 trips planned in the next 12 months in Guatemala and Bolivia. So we have so much involvement. But I'm going to hand it over to Dr. Barrows because our board said that we were going to have 9 key strategies for this ministry, 3 of which are under advocacy. And the number one advocacy objective that our board said for CMDA would be that we align our advocacy priorities with Jesus' advocacy priorities. So not a small challenge to Jeff and to our ethics committee, but Jeff has taken it very seriously. Jeff, you want to take it from here on where you took our board's objective?
Yeah, it was quite an assignment, but essentially I've looked at the whole concept of biblical justice, and we have developed a framework to look at various issues. And I'm sure it's not going to be any surprise to you, Ashleigh, that the issue of human trafficking scored very highly. And what it says to us is that while in the past we have these different ministries, including the work of the commission, and as Mike described, the overseas missions, we are now in a process as a advocacy team to begin focusing more efforts on the issue of human trafficking. And so my question to you is, and we do not just legislative advocacy, but we're open to other kinds of advocacy. So I've kind of lost track of what's happening at the national level in the last several years since I've been working at CMDA. So I'm very interested in hearing from you how we as a national organization in healthcare can make a difference at the national level in this whole issue of human trafficking.
Yeah, great question. And I love all those efforts. So slow clapping, all of those who've been participating in that. I would just add, human trafficking, the presence of human trafficking in someone's life, in our communities, in our world, is the darkest of consequences of so many vulnerabilities that have been left unaddressed in that person's life. So when we're tackling trafficking, we are simultaneously trafficking issues like homelessness and poverty and family breakdown and orphan care. I mean, these are all connected. And when we don't see them as connected, we're dealing with them sort of separately. We're not winning that war. So we've got to see them as connected, as holistic. When it comes to engaging at a public policy level, so I have advised our national government, other international governments, a lot of our legislators on these issues. I would say maybe the really big things to remember here is to make a commitment to be, I'm singing to the choir, but make a commitment to be part of the solution. What can create a wall, between a group like CMDA and or anyone who's trying to advocate for policy changes and those in a position to do it, is if we're taking the stance as bystanders or as finger pointers, right? So people who just want to yell about something that is bad, it's terrible, right? But they're not willing to be part of the solution, to be in a listening posture and figure out how to meet needs. That's not CMDA, I know, but I would coach anyone, who's interested in doing this on a local, state, or federal level. Come prepared to sit at that table and go ahead and get there, right? Go ahead and start meeting with your legislators, maybe that have attached their name to human trafficking legislation, in the past, and go and say, hey, this is who we are. This is what we've done to date. And we would love to help continue to move things forward. We think our perspectives are important, to be able to share here at this table. And I want to remind everyone on this call, my work in public policy is stopping train wrecks a lot of the time. So because legislators and policymakers are only hearing from who they're hearing from, by the way. So if you're not at the table, they are hearing from someone else, and it might not be the whole picture. It might be a perspective, right? It might be a bit, a piece of the puzzle, but they need to be hearing as many pieces as we can and come with solutions in mind, but come also listening. So come by saying, hey, here's what we could do, or here's what we're saying, but tell us what you're saying. Tell us what you're, hearing, and how can we come together? And I think taking that posture of partnership when we're talking about policy and that posture of we are going to do something, like we're not going to walk away from this conversation patting each other on the back because we had a great conversation, right? We are going to walk away with takeaways, walk away with next steps, walk away with meeting some immediate needs. That's when your voice is going to be someone that they can rely on and that they will call on to participate. And your voice is critical in this fight. It's critical from a profession, a healthcare professional. It's critical from a faith-based perspective, right? I mean, you've got so much to bring to the table, but you just start by being there and being ready to do whatever, even small, is needed to sort of build that relational equity and trust equity that will mean you'll be invited to bigger tables moving forward too.
Well, we've been speaking with Ashleigh Chapman today, and I want to thank you, Ashleigh, for your incredible example. Paul told the Corinthians, follow my example as I follow the example of Christ. And I believe you are doing that. I have met so many Generation Zs out there, 20-somethings, who would love to become you. I mean, honestly, they care deeply about causes that matter. And our listeners have heard today about a cause that just really matters right now. And so keep doing what you're doing. What website can our listeners go to find out information? I was on one last night and saw a bunch of courses for about $45 that can give you everything you want about fighting human trafficking.
It's so true. Yeah. So learnwithjusticeu.com, you being like your university. So learnwithjusticeu.com has all of our online courses. EngageTogether.com has all of our resources for community advocates, including healthcare professionals. So whereas you go to Justice U to take courses, maybe even get CEUs, really unpack that knowledge and build that knowledge for yourself, Engage Together is that step where you say, okay, I'm ready to act on that, but what could that look like? And how do we build bridges in our relationship? How do we do a community assessment to figure out where we're strong and weak in our own city? Engage Together will provide all of that for you. So engagetogether.com, learnwithjusticeu.com is where you can go to learn. So, and if you can't find what you're looking for, just knock on our door. We have a team on standby. We've helped over, I don't know. I was looking at my inbox, how many folks I've responded to in just the last 365 days, and it was over 72,000 in the last 365. So we are very responsive. If you need to knock and find something you're looking for, we're here for you on that too.
Well, Ashleigh, I am so thankful that you, first of all, got involved in this issue years ago and that you're still involved. I'm thankful that the Lord is using your entrepreneurial giftings to start all these organizations. So keep up the great work.
And tell your husband thank you for giving us an hour on your day of moving into your new home.
Yeah, I got to go help him, get it all unloaded. But we appreciate that. We're both so committed to this. And Luke 4:18 is my life verse, Mike. So it's the one I read when I was 11, and we were caring for foster care kids in our home. And I thought, if this is what Jesus is about, I want to be about my Father's business. And I think it's a call to all of us. So I love that you guys are putting that front and center too. Well, for our listeners, I don't think this is the last time that you're going to hear from Ashleigh Chapman. Whether or not it's next January or not, I don't know, but we're going to figure out other ways to work together in collaboration. Ashleigh Chapman. Thank you. God bless you all. Thank you for all you do. Wow, those statistics that Ashleigh shared with us, especially the number of times that these victims encounter us as healthcare professionals before they come out of being slaves in this trafficking industry, those are mind-blowing to me, and they're incredibly sobering. More than 50 million people, both globally and online, across every demographic and every community, have been entrenched within the horrors of human trafficking. We've heard some of those statistics before, but somehow hearing how the COVID pandemic drastically increased trafficking, especially those online forms of child sex trafficking and child exploitation, well, it brought new awareness to my eyes. As Ashleigh so passionately shared with us, these men, women, and children are facing complex trauma with more than 10 concurrent physical and mental health conditions each. And they need people like us. Physicians, mental health professionals, dentists, nurses, office staff, and many others. We need to recognize their need and to help them. So what can you do to start engaging in this area? Well, the first step is training, and we just talked about some great training resources available for you through learnwithjusticeu.com and engagetogether.com. I hope that you'll check out the continuing education courses that they offer, including training for your office staff. To make it easy, we've included a link in our show notes for you today. Well,
Well, CMDA does have some great resources available to help you step into this arena and proactively start learning now so that you can see the signs and know yourself when victims of human trafficking are face to face with you in your exam room and in the hospital. As Ashleigh just told us, we play an important role in identifying victims in our local communities. The first place to visit is our CMDA Learning Center, which I hope by now you're familiar with, especially if you're a member, because it's an exclusive benefit for our members that offers you free continuing medical education credits. In the Learning Center, you'll find a 12-module series developed by our CMDA Commission on Human Trafficking. This course gives you an introduction to human trafficking here in the U.S. It explains how you can spot the signs of patients who are being trafficked. It also will help you discern how to both help and treat those patients and much, much more. If you haven't taken the time to go through these modules yet, I hope that you'll do so in the coming weeks in response to hearing our conversation today. Will you commit to doing so in the next month? It will be incredibly valuable to you, and it's a wonderful step to proactively learn more. To access the course, just visit cmda.org/learning. That 12-module course was created by CMDA's Commission on Human Trafficking. This commission exists to equip, support, motivate, and transform our CMDA members in their role to abolish human trafficking within the United States as well as abroad. You can visit cmda.org/human trafficking to learn more about our commission and get involved yourself. The second step that Ashleigh shared with us is protocol development. There are some great resources available from the Commission on Human Trafficking as well as through the website learnwithjusticeu.com to help you develop protocols in your office and in your hospital about what to do when you encounter trafficked patients. One specific article I want to bring to your attention is an article that was published in the spring 2021 edition of CMDA Today, our quarterly publication. This article was written by Drs. Paul Glazer as well as Joyce Lowe and is entitled Common Psychiatric Consequences of Human Trafficking on Children and Adolescents. The article will help provide you with a framework of knowing how to establish mental health care as part of your management of children and adolescents who have experienced human trafficking. The third step I'd like to share with you is to build bridges by coming alongside those who are working to help trafficking victims and survivors in our local communities. As Ashleigh told us, access to ongoing health care is a very real challenge for survivors. Let's commit to following these 3 steps to start making a difference for survivors in our communities today. During our conversation, you briefly heard me mention some upcoming mission trips with Global Health Outreach to help victims of human trafficking in underserved countries like Bolivia. Jamie's got some more information for you today about going on a trip with Global Health Outreach.
Are you interested in short-term mission trips? Well, now is the time to start thinking about signing up for a Global Health Outreach trip. GHO sends teams around the world to places like El Salvador, East Africa, India, the Pacific, Central Asia, Nicaragua, the Middle East, and many others. Through these trips, we disciple participants, grow national churches, share the gospel, and provide care to the poor and needy. Our teams minister in outpatient primary care medicine and dentistry, and in small and large hospitals to provide surgical services. If you are interested in using the skills and resources the Lord has entrusted to you, please visit cmda.org/GHO to learn more and find a trip that works in your schedule.
If you're still looking for more resources on this topic, I've got a book to suggest to you. My co-host for today, Dr. Jeff Barrows, actually dedicated 15 years of his career to fighting human trafficking within the intersection of trafficking and healthcare, as well as the rehabilitation of survivors of child sex trafficking. he also trained many healthcare professionals on how to recognize and assist victims of trafficking within healthcare. Well, he became a novelist and wrote a book about spiritual warfare involved in human trafficking, and we have it available for you in our CMDA bookstore. It's entitled Finding Freedom. So you can visit cmda.org/bookstore to get your copy of Jeff's book today. Over the past couple of weeks, I have patiently waited for our final gifts to be tallied so I could accurately share the results of our year-end general fund giving campaign. I'm sure you'll remember me a few times telling you about our goal for November and December. It was $655,000. I am so excited and pleased to share with you today that we received, wait for it, $949,000. What an incredible blessing that this outpouring of generosity has been to us in the CMDA office. Throughout the fall, we've had to make some tough decisions, including reductions to our ministry budgets as well as our personnel. The cost of doing ministry, honestly, it's increased significantly during this current inflationary economy. I'm so grateful for each one of you who prayed for us and gave generously to help our CMDA finish 2022 strong and be well positioned to begin this new year. While the Lord has certainly blessed us at CMDA with a generous margin to begin 2023, we still have a ways to go to make sure the vital work of your CMDA remains fully funded during the second half of our fiscal year. I want to encourage you to continue to pray for us and support the work of your CMDA. Each month, we get to hear personal testimonies from those who, through your generosity, your gifts are helping them to be transformed. Today, I wanted to share two of those with you. I hope you'll be encouraged. One is from a first-year medical student who said, CMDA quickly became family and encouraged me to pursue God, even when life was challenging and I didn't always understand how God was working in my life. The community where we can challenge and encourage each other in love has been an amazing blessing to me. Another testimony from a first-year medical student. They said, pursuing a career in medicine at a secular institution poses many challenges. It can feel isolating to navigate the medical profession from a Christian worldview. However, CMDA gives students like me a community and a sense of belonging. Again, I want to thank you for helping to bring the hope and healing of Christ to our world, at home and abroad, and through your CMDA. Next week, Dr. Barrows and I will be back for a conversation with Katie Faust, who is the founder and director of Them Before Us. It's the only organization solely devoted to defending a child's right to their own father and mother. Katie is actually one of our plenary speakers at the upcoming 2023 CMDA National Convention. They're in the greater Cincinnati area, and she's going to give us a preview of what she'll be sharing at the convention, including talking about a brand new book that she's releasing later this year. Don't forget, if you'd like to suggest a future guest for the podcast, you can just email us your suggestion at cmdamatters@cmda.org. And if you like our podcast, be sure to give us a 5-star rating and share us on your favorite social media platform. As I wrap things up here, there's no question that fighting human trafficking is important to CMDA. Will you join us in making a commitment to be part of the solution? Friends, we don't want to be bystanders. I wholeheartedly agree with Ashleigh that we at CMDA with our members want to be part of the solution. Are you ready to take a seat at the table? Our role as Christians in healthcare is critical to this problem. And as you get involved in helping the vulnerable among us and freeing them from the evils of trafficking, you will bring the hope and healing of Christ to our world. You hear me say it every week. That is what matters to CMDA and CMDA Matters. We'll see you next week, friends, God willing.
This podcast has been a production of the Christian Medical and Dental Associations. The opinions expressed by guests on this podcast are not necessarily endorsed by the Christian Medical and Dental Associations. CMDA is a nonpartisan organization that does not endorse political parties or candidates for public office. The views expressed on this podcast reflect judgments regarding principles and values held by CMDA and its members and are not intended to imply endorsement of any political party or candidate.